And we are live, everybody. What is going on? I am back at you with another live stream tonight. What we're going to be talking about tonight, as you're tuning in, give me a hashtag live or give me a hashtag replay as you're tuning in. Everybody, come on in. Give me a hashtag live or a hashtag replay as you're coming in. I'll put some comments in here for you guys. Now, tonight, we're going to be talking about my best tips for EMT, Advanced Emt, and Paramedic School, okay? So how to prep and excel in school, okay? So we're going to do this all inside of one video. So let's dive into it, okay? So as you're coming in, guys, give me a hashtag live, give me a hashtag replay. Make sure my camera set up here. We look good. All right, everything looks good here, set up. You move this down an inch. Okay. Guys, hear me and see me okay. All right, awesome. So everyone who is live here, we got some shout outs. We got Kayla. We have Jimmy and Sarah, Nick, Andrea, Adam. What's up, brother? Fire Medic. We have Anna. We have Emily. We have Adam, Nick, Kayla, Dan, myself. I'm here. That's good. Daniel. We have Ashik on the live as well. We have Christina, Daniel. Daniel, hope you're doing okay, bro. You're injured. I hope you're okay, brother. Everyone, let's send some good wishes to our paramedic coach member, Daniel. Letitia, Jordan, Thomas, Angela. We got Kayana, Ada, Tony. We got Howard, Kim, Brittany on the live. We got Kimberly on the live as well. Connor. Guys, what is going on? Hope you are doing well. We got about 56 people on the live cast. So let's dive into it. So first off, if you're not aware, if you're totally haven't heard, okay, this month I am holding a giveaway for this Littman Master Cardiology Scope, okay? I'm announcing the winner of the giveaway June 28th at 7:30 Eastern Time. Now, I'm also giving away with this scope, not just a scope, I'm also giving away a $600 EMS education grant to give back to you. So one lucky student follows me on Facebook, YouTube, TikTok, Instagram, okay? If you're not on the platforms, get on all of them as I do daily tips on Instagram and TikTok every single day. And I do lives on Facebook and I do my posts on YouTube. I'm giving away a Master Cardiology plus a $600 now. That's the announcement, by the way. The giveaway has gone from $500 to $600. I had one of our members inside the paramedic coach actually give to the cause, give $100 for this lucky student. So it is now a $600 giveaway towards one lucky student. Now, there's not that many rules and regulations, okay, for the giveaway. Anyone can sign up, okay? Now, my hope is the winner of the giveaway is either in school, preparing for school in the next 3, 6 months, year, whatever, or they're at the end of their school. Just drop my marker. First time I ever dropped it in the live. Okay, I made up for it. So, or they're nearing their NREMT, okay? We have about 73 people on the live. I will put my TikTok down below. If you just type in the paramedic coach on any platform, the paramedic coach, you will find the paramedic coach, which is me, okay? So what we're going to be talking about here tonight, and I got so many people on the live right now. I'll shout out a few more. We have Sanaya, Alex. We have Liana, Doris, Nicole, Alex, Chris, myself. That's good. Chris, Doris. We got Dana Wilson. Dana Wilson, everybody, is one of the original OGs of the paramedic coach from back in the day. So Dana, what is up, my friend? She's a paramedic for a few years now. All right. We have Nicole, Molly, Nicholas, Teresa. Oh, let's go. Let's go. Teresa says her daughter, Katie, just passed her NREMT. Congrats. I've seen both of you on Facebook commenting, messaging. So that's awesome. We got Paramedic Holmes, OG. I'm in. We got a few more shout outs before we start. We got Andy, Wells for God, Christina. Dale says, thanks, brother. We're doing a burpee. Hey, brother. It's all good, man. You know, one thing I will say about working out, I'm a big runner. anything you do in fitness, at some point, if you really work hard at it, you're probably going to get hurt at some point. Not a bad thing. It's just part of the game. Kind of like life. Kind of like an 911 call. You know, just because something bad happened, we continue to move forward. You know, there have been times where I couldn't run because I got hurt or whatever. It sucks. It makes you feel good. But, you know, you just got to keep moving forward on the journey to whatever your goal is. And that's how I always tell people, so in running, and that's what I tell people here too. We got Molly and Bailey as well. Now, let's talk about tonight's topic, 86 people on the live. Just to make sure everyone knows, I'm holding a giveaway. I'm going to put the link down below at the end of the giveaway, okay? This giveaway, I'm giving away $600 to one lucky student plus a master cardiology scope, okay? Now, everyone knows that. We got 86 people on the live. Let's dive into prep. So what I want to talk about tonight is the number one thing that I get questions on. The number one thing. Do you want to know what it is? I'll tell you what it is. Evan, I'm getting ready to go to EMT school. I'm getting ready to go to Advanced Emt school. I'm getting ready to go to Paramedic school. What the hell should I do? Tonight, I'm giving you my best tips to these people. I'm going to explain to you. If you are preparing right now for EMT school, for Advanced EMT school, or Paramedic school, you're going to want to watch this live in its entirety. If you're going to the last level paramedic, you're going to learn along the way and refresh. If you're starting off at pre-EMT, you're going to learn a hell of a lot. And you're going to be able to map out a career path for you, okay? If you're in the middle and Advanced EMT, you're going to learn some new stuff, and you're going to also do some refresher with your basics. So that's what we're going to talk about tonight, a little career stuff, but also how to best prepare and what you have to go over. I'll tell you, I didn't have this when I went to paramedic school. I went to paramedic school in 2012, okay? EMT school was 2011, okay? So let's dive into it. Now, we're going to start off where people, and you know what? I'm going to say it. You know what? I'm going to say it. So many instructors, other instructors, not hitting anybody, I'm just being honest. So many instructors forget about where the person's at when they start EMT school. When I started EMT school, I was trying to change my life and go in a totally different direction with my life. Didn't really know where I wanted to go, and I end up at this EMT class. I didn't come from a place where everyone was in healthcare, everyone was a first responder. I was like a lone wolf. Like, I was the only one in my whole family. But I had a passion for what the job looked like, and I ended up on day one of EMT school. Maybe that's you, and you ended up here, and you're trying to learn more. I want you to know you're not alone, my friends, because I was there too. Okay, I was there too. I was doing the same thing. I showed up at EMT school trying to change my life, and damn, did it. Damn, it did in a really good way. Now, let's talk about prep for EMT school first. And this is not only prep. Can I tell you a secret? I'll tell you one secret. There's stuff that I give out for prep, like I'm going to give you tonight, that you might have a breakthrough with when you're deep in school right now. Because it's happened down in my messengers, and it's happened from feedback from my students. This live tonight was based on one thing, feedback from you. So let's dive into it. So what we're going to talk about here is going to be first, what we need to do best to prepare for EMT school. These are simple things. And please, 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 if you're out there and you listen to my advice tonight, I'm going to be saving you so much headache, so much wasted time. Who wants a headache? Who wants to waste time? Nobody. So let's dive into it. Here we go. EMTs first. So EMT. What people don't talk about the EMT students is that most of the time the EMT students is coming from a place where they're not coming from healthcare. Where did I come from? I'm a 19-year-old who came off the street. Hi, I'm in EMT school. Hello. That was me. No healthcare experience, never did nothing. And here I am. Maybe that's you. It's probably you too. I was there as well, okay? So what do we do to best prepare? The first thing is we're going to talk about the practical skills that I would recommend you learn. And by the way, they're not that hard. Meaning you can easily get either your hands on the equipment and practice beforehand, or you can at least learn about it, understand these things. So let's start with skills first, and then we're going to dive into some theory, okay? So blood pressures first, okay? Learn how to take a blood pressure before you go to EMT school, okay? That is going to be one of my first things. You want to know your blood pressure. You want to know your pulse. I'm going to explain all this, your pulse. You want to know your respiratory rate. Now, what does it sound like? It kind of sounds like taking vital signs. Wait, what does every EMS provider do on every call, no matter what level? Take some vital signs. What if you knew vital signs before you went into school? Home, man, you'd be ahead of me. Right, exactly. You'd be ahead of where I was when I went in. So I didn't know. I had to learn the hard way while I'm being tested on it. You can learn ahead. So respiratory rate, I'm going to tell you right now. We're going to focus on the adult. Because if you're a pre-EMT right now, I don't want to get you all over the place with all different kinds of people. But just focus on knowing the adult before we go in at least. Cold, okay? The respiratory rate of an adult is 12 to 20, okay? The average, okay, for an adult patient, okay? Respiratory rate means how many times in a minute am I breathing, taking a breath in and out. That's my respiratory rate, okay? The pulse on an average person, okay, it's going to be 60 to 100. Now, I'm going to give you a pearl here, okay? I'm going to give you a pearl. I myself, I have a pulse oximeter over there, okay? I did a TikTok on it earlier today. I'll be going on Instagram later. That pulse oximeter, for me, standing here like this, relaxing, I look down, it says that my heart rate's 46, and my SpO2 is 99%. Why is that? Am I not normal? Do I have a disease? No. People who are athletes, okay, I told you I'm a runner. People who are athletes, their heart can be lower, sometimes 40s and 50s, okay? So that's a quick tip to keep in mind you might get on a test, okay? But the normal average person is 60 to 100. Now, we talk about blood pressure. What's the normal blood pressure? I'm not going to get technical here, but I want to give you my feedback from my head that will help you when you're in clinical to understand what your EMT, your advanced EMT, your paramedic, instructor that you're on the ambulance with talking about. If I see a patient and they call 911, okay, I'm worried about two things. Their blood pressure being really high or really low. If it's somewhere in the middle, I'm not going to freak out about it in EMS. Okay, I'm not a primary care doctor, I'm a paramedic. So I'm worried about emergencies. Is it really high? Is it really low? Okay, so a standard blood pressure by the book that's really good is when you go to your family doctor is 120 over 70. That would be a gem. That'd be great, okay? Now, right now, we got about 75, 76 people on the live. You are all absolutely awesome for spending your money night with me. I love you guys. Thank you for tuning in. Now, 120 over 70 would be your normal blood pressure, okay? Now, in the ambulance, if I see a patient and their blood pressure is 130, 140, 150, 110, am I going to freak out and treat the blood pressure? No. We don't do that in EMS. The blood pressure is going to be a tool that we use to tell certain things. For example, if someone says they're in 10 out of 10 pain, and I see their blood pressure is like 140, 190 as a top number, I might go, damn, that looks like they really are in pain. And their heart rate's over 100. And the respiratory rate's over 20. That patient is in real pain right now. Their body, their vital signs are even showing it. And they're saying it as well. That's what we use blood pressure for in those middle ground scenarios, okay? Or it could be the start of a hypertensive. They're getting too high or getting too low. So you gotta know what's normal, okay? Make sense? Make sense? Okay. What's really high? What's really low? I'm going to share it with you. Let's say the person's 180 over 100. That's really high. Okay. Let's say somebody is low. They're under 90. I'm going to keep it simple for you because you're just starting. Under 90, do you know what it means? Do you know what it means? Who knows what it means? Put it in the comments. A systolic blood pressure of under 90. What that means is you're at risk of not getting enough blood and oxygen to all of your organs. What's an organ? Well, everything we talk about in your body. That's what it is, okay? I'm going to give you another tip after this for getting prepared for EMT. You ready? Here it is. Okay, now, let's talk about a quick lesson here I'm going to share with you, okay? They're going to be quick lessons. I'm just going to show you real quick, rapid fire, but they should plant a seed in your head, okay? So here we go. So now we know some vitals. Okay, so we're going in knowing vitals. That's great. Excellent. Now, what are we going to go over next? Well, a few different things are going to help you tremendously. I'm going to go over them quickly here on the live cast, okay? Now, you know we have a heart, right? Right, we have a heart. Did you know most students struggle with heart blood flow and they don't understand it at a top level? Did you know that one time I had someone who was preparing for medic school who didn't know heart blood flow? For some reason, heart blood flow, which is the structures of the heart, get in the way of education. I don't know what it is, but I'm going to explain it to you very simply right now. Fast, but effective right now. Then I want to share with you two simple things about the lungs. Simple, okay? And then what we're going to do is jump into something new, okay? Here we go. Now, here's what we're going to talk about, the heart, okay? We have a heart here, okay? I'm going to break up the heart into a few slices here. We're going to go like this and go like this. I'm going to put a tube here. Here's a tube. There's my tube, okay? I'm going to put a box over here. That's going to be the lungs, okay? There are my lungs, okay? Then I'm going to put a hook and a few other pipes as we go along the journey. Hang with me, 86 people on the live. Give me a hashtag live. If you are one of these 85 people on the live, you are awesome. Thank you for tuning in, and I'm happy I can deliver you this awesome content. Remember, if you're just tuning in live, we're going from EMT, Advanced EMT to Paramedic. Right now I'm taking care of my basics, and we're going to go forward and forward and forward, okay? So here we go. We have here our pipe, our four, and our lungs. Give me a hashtag live if you're on. I got to know you hear me, hashtag live. Okay. The first thing we're going to talk about is very simple. Arteries go away. Veins, okay, are going to be opposite. In the body, I want you to think there's only two main pathways. Like trains on a train track, there's only two main pathways. Like trains in a train pack, and then one goes this way, one goes that way. So those two pathways are arteries and veins, okay? So the thing is, arteries have an A in it, so arteries go away from the heart. If we know that, we're ahead of the game. Let's get more ahead of the game, okay? Now, I'm going to label some things here. Right atrium, right ventricle, okay? Left atrium, left ventricle. Okay, great, Evan. Let's move on from there. Now, the heart, I want you to think about it. These are four different sections, four different chambers, you may call them, okay? Four different sections, four different areas. Whatever word makes you remember it, okay? Can I give you a secret? I'm going to give you another secret, guys. If you can't understand this at a basic level, you'll never understand it on a test. And that's what I handle right now, your basic level. So it clicks, you go, oh, I get it. And then you move on, okay? So I'm going to label a few things here, okay? We're going to talk about them. Not yet. I'm going to say that for you. Okay, let's continue. Now, you got to know the role of the heart. what the heart does. The goal of the heart is to pump blood around the body. So we need to get blood all around the body. We got to get to our head, to our feet, to our hands, everywhere, to our organs and our stomach. We got to get blood everywhere. Right. So what we got to do is the heart is the pump that does all that. But what's blood without oxygen? What's blood without oxygen? So the heart's got to work with the lungs to provide oxygen to the blood before it gets pushed out to everywhere else. My hands, my feet, my legs, my head, everything else. Does that make sense? Okay. So arteries go away. Veins must come back to the heart. Right. So what this means. This right here is your final ending right here of your veins, your venous system, okay, returning to the heart, okay? This is called the superior vena cava and the inferior vena cava. Whoa, Evan, you lost me. I'm leaving the live. You're talking crazy now. What the hell are you talking about? I'm going to explain. Superior and inferior. Superior means above something. Inferior means below something. Vena cava, take that crazy word away and use the V. It has to do with these veins, the venous system. Just think about the system that returns to the heart is opposite than the arteries, that system. You have an A system and a V system, and it's all going to make sense at the end. But this is how we get it down cold, okay? Now, as the blood returns back, think about it. Blood's got to come from up here, and blood's got to come from down here, okay? So as blood returns and comes through, okay, what happens next? It ends up at the right atrium. Here's what I want you to remember the atria versus the ventricles and where the hell are they? I want you to think in your mind that A, again, comes before V. Atria come before V. Why would you put a V in front of an A? That doesn't make any sense. A, V, A, V. There you go. Okay? The alphabet it's not V, B, C, it's A, B, C. So A comes before V. There it is. Okay. Now, that's how I remember where these are. The other tip I give my students is this. I want you to think of the ventricles as having a job to do. They're strong. They got to pump blood to a certain area. The right ventricle has got to pump blood to a certain area. And the left ventricle is strong, and it's got to pump blood to a certain area. We're going to give the ventricles a job to do. A job the atria just can't do. It's not strong enough. That's the way you're going to remember it, okay? So the right atria now gets this blood that has no oxygen on it. There's no oxygen on it. The oxygen's already been dropped off. So now the blood comes back to the heart, okay? As we go through, it comes down. The atria says, I'm too weak. I'm going to give it to my man, the right ventricle. Give the right ventricle a job to do. What's the job it's got to do? This blood needs oxygen, because what's the point of pumping blood if it's got no oxygen? So the right ventricle partners up with the lungs and makes a pathway. Pulmonary artery. Wait a second. Didn't Evan say arteries go away from the heart? I did. That's how you remember this. Okay. Now, the lungs. What does everybody on this earth know about the lungs? They have oxygen. Right, exactly. So if the lungs have oxygen, what does this mean? That means we probably got to get some oxygen from this pathway. You're right. Okay? But we got to get the blood back to the heart, because the heart's the pump. The lungs aren't going to pump anything. Right. So God made this pathway called the pulmonary vein. Wait. Pulmonary vein. Didn't Evan say veins go back to the heart? I did. Pulmonary vein. Why is it pulmonary? It's got to go. It's going to and from the lungs. Pulmonary, respiratory has to do with the lungs. My pre-EMTs. Okay? Remember what I told you? The atria, it's too weak. It can't pump the blood like the ventricles can. It pumps it over to the left ventricle. Then the left ventricle, I want you to think, the strongest of all the chambers, all the sections, pumps the blood around the A, going away, aorta, around the hook and down, around the arch and down. The pressure right here is extremely, extremely high, and you want to watch out for an aneurysm right there. That can be life-threatening in seconds if that was to burst. That's how much blood and pressure is there. Okay, this is called This is called the aortic arch. Okay, and then blood is pumped out to the rest of the body. Okay, and you have other ones going here. Fair? That is heart blood flow. Okay, now this live isn't going anywhere, but that is heart blood flow. If that helped you and had a breakthrough with you, comment down below. Give me a hashtag live if you like that and that made sense. Okay? Give me a hashtag live if you like that and it made sense. Now, there's one thing I need you to know if you're getting ready for EMT school. One more thing. This is a quick tip about the lungs. Okay? The lungs. It's simple, but I just want to share it with you. Because I remember when I went to EMT school, I was lost. I was lost when I'm like, what the hell does that even mean, man? Okay, think about it. Ready? As I breathe in and out, how does that system work? Okay, let's talk about it. Basics. There's just two simple things I want you to understand. Okay, just two, and then we're going to move on. But I want you to know this. Okay, everyone knows about, and they think, okay, here's my throat, okay, here's my trachea, okay, here's my windpipe, okay, but then no one thinks about what the hell happens in my lungs with the air and the exchange, right? Well, down the lungs, we have basically two branches of pathways. I'm just going to share with you something simple here, because you may not have heard it. We have our pathways here. These are our lungs, okay? They go off like this, okay? I just want you to know something very simple. You have two mainstem bronchi. What the hell is that, brother? Let me explain it to you. The mainstem bronchi, what they are, those are your lung pathways. Remember we talked about the pathways of the heart. These are the pathways of the lungs, okay? So you have a right and left mainstem bronchi. Now these go down into little and little and littler as they go down. Then they're called bronchioles. When they get down to the bottom, I want you to think about little pads, okay? Almost like a lily pad, okay? That's the way I think about it, okay? All the way down here. That's something called the alveoli. The alveoli. Right here, this is like your magnet. It's like the happy place for when your oxygen, carbon dioxide, that's going to be how well your exchange is. So what that means, if your alveoli is messed up, if it's disconfigured, if it's out of condition, if it's out of shape, you're not going to be able to have a good oxygen, carbon dioxide in and out. Okay? Patients that have a problem with their alveoli will be COPD and smokers. In emphysema, this alveoli, this lily pad where all the exchange occurs, this area gets disformed and disfigured. It's not a beautiful lily pad anymore. It's got holes in it. It's all messed up. It's disfigured. It doesn't look right. That's what I'm trying to say by that. I didn't know this going in. Now you know it. Okay? So that's that. Quick tip I want to give you. Okay? Now I'm going to give you another tip. Okay? About my EMT students. Assessment. We're talking about patient assessment in EMS and why you do what you do. Okay? Let's talk about physical examination assessment. Okay? With EMS. Okay? All right. So what I want to talk about now is patient assessment in EMS. Now, I'm going to talk about the awake patient who's in front of you who has a complaint. How do you go through a patient assessment? How do you structure that? Now, if you're watching on Facebook or YouTube, this week actually I'm coming out on videos talking about some of this stuff. I'm going to be talking about sample. I'm going to be talking about OPQRST. I'm going to be talking about mental health patients. A lot of cool stuff. I'm coming out with some cool YouTube videos throughout this week, going into next week, to really hammer assessment. So stay tuned for that. But I want to give you a quick tip about things I look for that might not be covered in class and are going to make you look sharp. Make you look sharp, okay? So I'm going to kind of just go off my head here, okay? I'll be real honest with you, this section right here, didn't plan it. But I thought about it and I said, I actually want to give it to you. So I'm going to give you a rapid fire, some of my best tips that I look for in patient assessment on a patient. You ready? Let's do it. So I'm going to start with the head. I'm going to go all the way on the body. And I'm going to give you quick tips throughout the whole body. You ready? Here we go. So the first thing we're going to start with, guys, is going to be the patient's head. Okay? The first thing you want to do in any patient, if your patient is wearing a hat, you need to take their hat off, okay? You need to take their hat off. You need to feel around their head, okay? You need to feel, okay, any bumps, anything at all, okay? Anything going on here. Back of the neck, anything going on here, okay? Nothing? Okay, great. Then you want to listen here for tracheal sounds that you want to listen for, okay? That makes sense, okay? So that's what you want to do first. I do it every patient, every time. So if I walk up to a patient, they're saying, oh, I have a headache. Oh, my neck hurts. I have pain in my jaw, my neck. Why am I doing my focused exam here? Hat off, I'm going to feel. Okay, look in the ears. Okay, I'm going to move down here. Make sure there's no deformities here. I always listen trachea here. I might get a quick carotid pulse to see how it is. Might listen on both sides. I'm going to feel the back of their neck. I'm going to give you a pearl. I always check their eyes. So I take my pen light, I'll do a light check, and I check for something called the vertical nystagmus. Whoa, what's that? Well, here's a quick tip that I never talked about publicly before. I'm going to talk about it to you now. Here's what it is. What you want to have the patient do is a type of stroke. It's a sneaky stroke that a patient can have that shows nystagmus, okay? A patient can have a stroke, and instead of being in the normal place where they have droop and weakness and all that stuff, they can have a stroke called a cerebellar stroke in the cerebellum. Now, what does that mean? What that means is that what that has to do is the world around you. So what that means is the patient will they'll have vertigo, okay? They'll have nausea, vomiting, a headache, and they're going to have nystagmus. So any neuro patient, I have the patient, if they're able to, look up. Hey, can you look up? When they look up, if I see a fluttering of the eyes, okay, and I'm thinking already it's that, whoa, brother, I might have found something here. So every neuro patient, have them shine a light in their eye. Hey, look up. So I'll look at the camera. So look up, and you're going to see if there's like rapid fluttering in the eye. That's what nystagmus is. It's fluttering in the eye. You can have horizontal, you can have vertical. Okay? Something I do. This is a focused exam on the awake patient. We might call it a secondary assessment. Now, as I move on, I'm going to get my lung sounds. Okay? So I have lungs. You check both sides. I'm going to check chest, underneath the arm, and the axilla. I'm going to go to the back, check the back. And I think that chest and back is one way down. If you were watching me in the back of an ambulance doing a secondary assessment, this is what I do step by step. Okay? Exam. So down. Now, I say, hey, do you have any belly pain? Do you have any stomach pain? No? Okay. I'm just going to check. But I'm going to give you a pearl if somebody has belly pain. A few quick tips about all this crazy stuff coming up here. Okay? So I'm going to draw out my 4 quadrants. Now, if you're a pre-EMT, what the hell is 4 quadrants? Okay? Let me explain. So what we have basically, we have a whole entire abdomen section. Let me move over this way so you can see a little more. Section here, okay? So my chest is here, and you're going to split this up into 4 groups, okay? Now, why did we decide to do that? Maybe to make it easier for us to study. I don't know. I didn't make the rules on it, but I can give you advice on how to talk about it and how to know about it when you have a patient. So let's do that. So we have 4 quadrants, okay? So when we have these 4 quadrants, we're going to start. I'm going to give you something to remember about each quadrant and bonus. Something to remember about each quadrant that I think about on a real call, plus a bonus. Okay? So we have the right upper quadrant. We have the left upper quadrant. Okay? So right is my right hand. Right, left. Okay? What else do we have? We have the right lower quadrant. Okay? And then we have the left lower quadrant. Okay? Right. So I'm going to tell you what is in my head when a patient has pain in these areas. Okay? So I go to a patient, and they go, oh, man, I got right upper quadrant pain. They're not going to say that. So they're not going to say it to you. They're going to go, I have pain. Right? And they're going to go, oh, my right upper quadrant. Oh, I got it. I know what it is. They're going to say, I have abdominal pain. So we got to do an exam. Hope you guys like that one. Okay. We got to do an exam to figure out what's going on with the patient and use signs and symptoms. So let's talk about those. The big thing that I find in the right upper quadrant is the patient's liver. So if someone says, Evan, tell me one thing about each of these quadrants you got to know, I'd say right here is the man, the myth, the legend, the liver. Okay? The liver. You got to know the liver, hepatitis patients are going to have pain right around here, the right upper quadrant. They're going to have nausea. They're going to have vomiting. They might be yellow on their eyes or their skin if they're in really bad shape. Okay? They may have a bloated stomach. Okay? As well. So check for that. Okay? You also want to ask them about their medications, that any recent change in their medications. Okay? That's a hepatitis assessment. How do we treat hepatitis in the field? Well, at the EMT level we're talking about now, this goes back to the #1 goal of the EMT. You know, I hear a lot of EMTs say stuff like, oh, you know, I wish I had more tools. I wish I had more of this. You know, I can't wait to go to medic school. And hey, I'm with you. You know, I went to medic school, and that's where I am with you. I'm with you. But do you know what anybody can do? Anybody can learn. And not just learn, anybody can call something out. And what do you mean call it out? I mean, do you know the whole goal of EMS is to find life threats? That's the whole entire goal, is to find life threats early so the patient has a better outcome. And all that we really do at EMS is use the different tools that we have to stabilize the patient so they make it to the hospital. That's the goal. So an EMT can figure out this man might be having an attack with hepatitis. He's got nausea, vomiting. He's got pain here. Okay, I know what he needs. Maybe I can't deliver it, but I know what he needs. He needs to go to this hospital and at this time. Let's do it. And that's how you do it. Okay? That makes a good provider. Okay? Now, left upper quadrant. What are you going to do? Okay? Well, my main item in my left upper quadrant is going to be my stomach. Okay? Okay? I know it's not technically like right there. It's a little, you know, it's a side. But when I think about the left upper quadrant, I think about the stomach. Okay? My main piece. Okay? Why? A patient, I want to share it with you, that has pain in the epigastric area, okay, or the left upper quadrant, okay, that patient could very well be having a heart attack as well. So if somebody, I'll give you a pearl. If someone comes to my ambulance and they called 911 and they have nausea, vomiting, and they have epigastric pain on your stomach or left upper quadrant pain, I want you to don't get fooled. That man or woman, you probably do an EKG, especially in sneaky patients. Okay, that's my pearl for you. Okay, again, if you're an EMT, you can't do an EKG. It's okay. In some areas you can do it and send it, whatever, it's fine. You gotta know the life threat. The whole point of being an EMT is to find life threats so they get to the right place so they can be treated appropriately. Okay? Now, right lower quadrant. What's the main player there? I'm gonna give you a pearl. Okay? The right lower quadrant is your main man. The appendix is there. The appendix. Okay? The appendix. The appendix. There's a point where we're going to talk about the appendix. I'm going to give you a pearl to test on your patients. So what you're going to do here, okay, is here's our stomach here. We have our basically our belly button. Let me go this way. Shoop. We have our belly button right here, okay? And then I want you to go like this to your hip. Don't hurt yourself, okay? There's a big bone here, okay? So that big bone, I want you to put 2 fingers on that big bone. Everybody do it on the live, okay? 2 fingers on that big bone. 2 fingers on your belly button. Everyone do it, okay? Now notice the path. You can see pretty much right there. Let me back up a little bit. That's perfect. So right here, I want you to go 2/3 toward your fingers over here, okay? So 1/3 would be like here. 2/3 would be like here. 3/3 would be the whole thing. So right here, okay? And that right there is called Mcburney's point. So if you press down on that hard, press hard. Make sure you're not having appendicitis. You press hard and let go, there's a massive amount of pain there. That's called Mcburney's point. You might want to document that on your abdominal patient. Okay? Next thing we're going to do is left lower quadrant. Okay? What's the main player in the left lower quadrant? I call it diverticulitis land. I call it diverticulitis land. Now, what is that? Diverticulitis is a GI, for lack of a better word, I'll call it a disease, okay? That basically, you have your large intestine. So let's go from the appendix, roll around, roll around, then go down, out. So right at that section, that end, that curve right at the end, there are these little pockets that are formed. And they get filled and get infected, and it hurts a lot. Patient will have dizziness, nausea, vomiting, and probably pain. Not always vomiting, by the way, but it could occur. But it'll be very, very painful, and they'll usually know of it. If it's their first time having it, they're going to think they're dying, okay? Now, what's my pearl? What's my pearl here? My pearl is patients with pain in their flanks. What's back here? What's back here? Back here, your kidneys. Oh, man, what about those kidneys, man? Yeah, the kidneys are back here, man. Where the hell are your kidneys? Back here, man. Okay? So the kidneys, when they have pain, they come in the flanks. I feel it's going here and going like in my sides, man. That's your kidney stone. That's your kidney stone. So I use this guide to guide my care, okay? When at my first glance of a patient, now you know it, just like I know it, okay? That's some patient assessment pearls with the stomach. Pretty cool? All right, next one. Okay? So that is that. Now, I want to talk about one more area of the body that no one talks about, okay? One more area of the body that nobody talks about. I'm going to scroll through some comments and do some shout-outs. Who is live with me right now? We're going to be here for a while, so hope you're enjoying yourself. Okay? Here we go. Let's go through some shout-outs here. Okay, quick shouts for the people on the live cast. Here we go. We got Jessica, Josh, Stacy, LaShawn, Sean, Angela, Matthew. We got Aaron, Camilla. We have Ada, Nicole, Adam, Paramedic Holmes, Justin. We have Monet. Hey, what's up? Kayana. We got a lot of members in the live, guys. Love you guys. We have Liana, Daniel, Doris. We have one of our new members, Mr. Robinson, TD Robinson. What's up, brother? We got Michelle, Matthew. Hey, what's up, brother? We got Angela, Ada, Matthew, Ada, Crystal, Shiloh, Terry, Ada, Daniel, Evan. We have Daniel, Angela, Jenny, Adam, Jamie, Nicole, Firemedic, Tony, Emily, Amber, Tyler, Kim, Missy, Xavier, Wells for God, my man. What's up, brother? Cameo, Tracy, Emily Coleman. Hey, Emily actually was our last giveaway winner, and she's in the live. What's up? Marshall, Michelle, Nicole, and that is where we're at. Someone mentioned a gallbladder as a right upper quadrant issue. Yeah, you're on the money with that. You're good. You're on the money with that. You're good. And then I think someone mentioned something about tracheal sounds. So tracheal sounds, what you want to hear there is clear. And I will give you a tip. Somebody on this cast might say, Evan, you're nuts. You're not making any sense. One's got nothing to do with the other. Okay. Call me crazy. Fine, it's fine. If you ever have a hard time hearing someone's lung sounds, their lungs, I want you to remember something. Real deep in here, right up here, right up against the clavicle. Listen right below that. It's usually a good spot. And usually if someone's an obese person, they won't have as much fat right underneath there. Okay, so it's a good spot. Okay, now with the tracheal sounds, you want to hear clear sounds. Okay, you don't obviously want to hear like a pug bark or something like that, or a constricting sound, okay, or a musical sound, like a wheeze or something like that. That would be found here. It would sound very similar. You don't want to hear that. My goal with that is I want to hear that everything is clear and okay. And it can also give you a little tip. And people might disagree with me and say, Evan, you're crazy. It will give me a little insight on the rest of the fields, because the lung field noises will kind of creep up a little bit into the trachea, a little bit, okay? Some people might say I'm crazy, but I'm just telling you from my experience, okay? So that was your tip, okay? So now what we're going to talk about is a quick tip about a part of the body that nobody talks about. Do you know we're still in EMT prep? We haven't even got to Advanced EMT or Medic yet. Where are my Advanced EMT students? Where are my Medic students at? Give me a hashtag right now. Are you an EMT student? Are you an Advanced EMT student or a Paramedic student? If you're a hashtag EMT student, hashtag EMT student. If you're hashtag AEMT student, give me that. If you're a paramedic, give me hashtag paramedic students. And if you're somebody else watching, let me know who you are, if you're a lay person or somebody else. Well, let's dive into it. So the legs, okay? The leg exam. My friends, I'm going to save your butt on a lot of calls here, okay? There's two main things I want to talk about the leg exam, okay? Let's talk about them. So the first thing and the second thing. The first thing is this. A patient who has heart failure, okay, is going to have fluid buildup, edema in both their legs, okay? So a patient with, if you're unsure, this patient having heart failure, check their legs. Okay, number one. Okay, number two. I'm gonna give you a bonus tip at the end, by the way. Just thought about it for you. Bonus tip. Okay, number two comes with a pulmonary embolism. If you think someone's having a PE, okay, what's that? A blood clot in the pulmonary artery and going down, a smaller one, a big one would be way up top. Okay, what does that mean? What that means is that it starts off with a DVT in the legs. That DVT in the legs, okay, can be big and swollen and painful in the legs when it's going up, okay? So what that means is if they have a DVT in their leg, it's going to be red, it's going to be swollen. Maybe that's why they're having a hard time breathing. There's that little bit of, we can call it whatever you want to call it, clot, broke off, went up the venous system and towards the lungs and lodged in the lungs. So a DVT is deep vein thrombosis. A deep vein in your leg is blocked, man. And a little piece of it broke off and veins go back to the heart, which go back to the lungs, which means it got caught in the lungs. Okay? Now, that's a pulmonary embolism. An emboli is the word for a clot. Okay? The bonus tip is checking the patient's legs can tell you just how well they circulate normally. So let's say you have a patient and you notice, man, they have like necrosis on their feet. Or like they, there's like, they have like spotting of the bottom of their legs. They have, some issues down here in the circulation. Maybe they're wearing special circulation socks. That could be just looking at them, an idea of a risk factor. That's a bonus tip. So check the patient's legs. Every time you need it, document something in your chart. I'm going to give you a pearl that my mentor, who's a physician assistant, shout out to John Belinsky, CME for life, my friend, gave me. And I put on my chart every single time. I'm going to tell you what it is. Now, I'm going to grab my friend, Tacky the Tiger, our friend, my sidekick here, okay? I'm going to bring him in and show you what it is. Okay, here it is. Now, everyone say hi to our friend. This is our friend here. Tacky the Tiger. This is our boy right here. He's going to demonstrate this. Everyone say hi to Tacky. If you know him from the Facebook fam, everyone say hi, Tacky. This is our man right here. Okay, now, Tacky here has got a foot. Okay, so here's his foot right here. Okay, so here's the leg, right in the stretcher. Okay, there's something called, you can even Google it. It's called a Hohmann sign. I'm going to put it here, Hohmann's sign. Okay, I learned this from my mentor, and I'm giving it to you. Okay, so my mentor told me to always document this on your chart. Anytime you have someone with chest pain, difficulty breathing. Because if you have someone with chest pain, difficulty breathing, you have to look for this, what I'm going to share with you right here. If you don't do that, and that patient has a pulmonary embolism, you got burned. You got burned, meaning that's not good, man. It looks like on documentation, you didn't do your job, okay? Now, here's the patient's foot. See how it's normal on the stretcher? What you want to do is you want to dorsiflex the foot. Bring the foot this way, okay? And you're going to ask the patient, so I do this every time. Hey, any pain? So I'll say, Tacky, any pain here? Any pain here? No, okay? Tacky, any pain here? Any pain here? Negative Hohmann sign. So any single patient, thank you, Tacky, any single patient, okay, that you have where you think they might be having a pulmonary embolism, check their leg, dorsiflex the foot, means the opposite way, towards their face, okay? Any pain? Any pain? The idea behind it is that it will pull on the vein and it will hurt. And then you could say, oh, it's a positive Hohmann sign on one foot or the other. It may not be the best thing in the world, but it's something you can document in EMS that if that patient that has clear lung sounds that looked okay to you goes to the ER and, oh my God, they had a big PE later, why weren't we aware of this? At least you put negative Hohmann sign. At least you did your vitals. At least you listened to lung sounds. At least you got a pulse oximetry. At least you document that in your chart. See? That's how you do it. Okay? So now we're going to talk about, and shout out to John Belinsky for that tip. That's you know, that was a great tip, my friend. So now we're going to talk about, let's scroll down here to the people. Boom, 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 boom. Okay, so now we're going to talk about here next to the 70 people that are on the live cast. Let's go, everybody. We're going to talk about IVs. You ready? Here we go. Okay, we're going to talk about Advanced EMT IV tips. Here we go. So the biggest thing about the Advanced EMT, at the end of the day, is it's kind of like a mini medic school. Now, in my crazy brain, I like to think of EMS, and you know how PAs, they have to go to med school. It's kind of like a mini medical school. I think Advanced EMT is like a mini paramedic school, basically. Kind of like it's PA going to doctor. It's kind of like AEMT going to medic, okay? Some areas might have Advanced EMT. It's okay. Advanced EMT, my friends, is going to be IV tips, okay? So my Advanced EMT brothers and sisters, let's give you IV tips. And by the way, this all goes back to what I said. If you're an EMT watching this right now, don't go, it's my time. It's my time to go. No, we're getting into advanced stuff. Woo, that's over my head. No. This is a time for you to stay on the live cast because what we're going to talk about right now can help out a struggling partner. You might have learned it right here on the live cast. They might not have seen this live. You feel me? You can always help your partners. We're a team in EMS. We're a team. Not one person. We're a team. We're a team. There have been times, my friends, that I've been on calls where literally, I've worked with great EMT partners Some that I trained up to be great EMTs. Some that were just great EMTs before they even met me. And there are calls they saved my butt on, saved my ass on. I can remember 2 in particular that still stick with me. Saved my butt because the EMT was watching out because we're a team. Like I'm watching out for him or her. They're watching out for me. You feel me? Okay, cool. So let's talk about IV tips for the Advanced EMT. Okay, here we go. So IV tips. Now, the biggest thing here with IVs, and we're going to talk about it, okay, is we're going to talk about what people mess up on, okay? Now, how to do an IV, that works. Maybe you have no idea how to do an IV. We can talk about it. Sure, I can talk about it right now. It's pretty easy, okay? Here's the arm. Here's your arm. The first thing I want you to know is you have the whole arm to play with, okay? So if my vein you can almost see here. Look, probably almost see. Maybe the lighting's bad. If I go down there, you can see right there. Yep, there it is. I'm gonna watch. This is gonna blow your mind. I'm actually a pretty good model on this. All I'm doing is lowering my arm, and I'm pumping. Look, you can't see it, but I'm pumping my hand, and there's no tourniquet on. Now, I have to be a good model for this. What does that mean? Now watch this. I'm gonna just tap it a little bit. Watch. Watch what's gonna happen. I gotta have no tourniquet on my arm. Watch. See it? Now you can see it even more. Look at that. See? I'm gonna turn over this one. See here? Look here. Right here. Oh, a little over this one. Sorry about that. Right here it is. Look. That's what no tourniquet on. Now I'm showing you this for a reason. Okay, that's what a vein, it feels squishy. Okay, and this is the gold mine of veins right here. They call it the AC. This is called the AC. Okay, I'm going to give you my best spots for IVs first. The first thing we do is put a tourniquet on the patient right here. Okay, and I can't go through all that. I have a video on my YouTube on IV step by step. Well, first we put a tourniquet on our patient. Where are my golden gem spots for IVs? Right here in the AC. I mean, look, guys, you can see the vein from here, for God's sakes. Okay? Right here in the AC, it's called the Antecubital Space. Okay? They scroll down. See this baby right here? Right here on the side, there can be a nice vein here on the side almost as well. You can see it on me right now. There's another gem, though, and I don't think you can see it on me without tourniquet on. I'm not a superhuman, okay? But right here in the wrist area here, right in the wrist, there's a great straight vein here nobody talks about. Straight vein. Okay? The other place here is on the hand. Okay? Now you're going to see my tendons on my hand. But right in the hand is another great spot. The front of the hand here, the straight vein, and then right here. This right here on your wrist here, this is ouch land. Okay? It's really hurts land. This is the last resort place we want to go. Okay? Now the other place we can go is if somebody is a CHF patient. Why am I saying this? You're going to understand in a second. I've seen a lot of cases where let's say someone's really hard for IV access. And because I've seen it, I've done it, it's happened. I'm going to explain to you, okay, the whole thing. Think of a patient that has JVD, jugular vein distension, right? You can put an IV in their neck, okay? But you got to make sure it goes the way of the heart. So the heart isn't going towards the brain, it's going this way. So the patients here need to go down towards the heart, okay? It can be a tricky procedure. It's another location you can go for an IV. Not the first place, the last place, but a place. The other place people forget about is the old foot. The old foot. So the top of your foot has great veins on it. Did you know I've actually put IVs in people's feet before? Because they had no arm access that I could see or look. And I actually put IVs in their foot. And it's right here. I've done it. Okay? So I think I've done 2 or 3 foot IVs before. I know I've done 2. Okay? I might have tried 3, not 2. Okay? Hey, I'm always honest with you guys, okay? So But I have done foot IV before. It was pretty interesting. And you go, well, yeah, what the hell are you doing, brother? But you got to do what you got to do sometimes, you know? So it is what it is. But that's that. So here are my IV tips. First is you need EMS you need to rush. But what I want you to do is take your time in your own space. One thing about new people that are in EMS, and even when you've been in EMS for a while, is you're going to notice that time on the ambulance, now on one call, you're going to feel like the call has only lasted 5 minutes. But the call lasted like 20 minutes. You're going to feel like 30 seconds is like 2 minutes. Because you're jacked up. Or things are happening fast. So remember this, take your time and get set up correctly. Be prepared before you do the IV. So get prepared, okay? Is the first tip. The second tip is what I just showed you. Lower the patient's arm. I have so many people that go like this. Okay, let's do an IV. And they're like this. Brother, you gotta lower the arm. I just showed you an example, just that. So you gotta lower the arm. Okay? You gotta tap that vein, and you need to know how to apply a tight, crisp tourniquet. Okay? All right? So that's that. Now, the next thing I want to talk to you about with IVs, okay, is about gauges and what tool to use with IVs. Okay? So when we talk about IVs, I'm going to share something with you. And again, I know it's weird. It's on my arm. My goal is to get a heart monitor and a mannequin for this channel. So right now we got our boy Tacky, our friend, okay? But I plan on getting a full mannequin and a heart monitor as we grow and grow and grow and grow and grow, okay? That's my goal. For now, we got Tacky in my arm right now, okay? I'm just going to show you here again. Now look here, okay? This vein, I'm going to go to the biggest one here, right here. Lower and pump. See, I'm doing practice what you preach. Lower and pumping. All I'm doing is lowering and pumping. No tourniquet. It works. See? Look. Right here. This vein right here, okay, is huge. The problem with the vein is that if you come in at the vein, right, and go towards the heart, okay, not this way, brother, this way, okay, is if you go in that vein at too much of an angle like this, like a dive bomber, okay, like a dive bomber, you go in and you go in like this. I know it's the wrong way, but can't do everything here, guys. I can't go like this. You can't see me. But if you come in at the angle like a dive bomber, like this, you come in like that, what's going to happen is you're going to go right through the vein. What you got to do is come in at a flat angle. Okay? So it's like instead of this, you want to come in like this. As flat as you can. Now, some people say, and fair play to them, to try to bend the catheter a little bit while it's still kind of together in the plastic, to kind of bend the catheter a little bit to try to make it done. Now, I've never done that, but I've heard people do it. I don't do it. Some people have done it. To make it more flat, to make it go in more crisp like that, like a okay? Think of like a nice jet, not a dive bomb. Okay? Okay? So we want to come in at an angle because the secret is these big, great veins, guys, they might not be as big as you think underneath the skin, meaning deep. They might not be very deep. They might be big like up here, but down underneath the surface, they might not be that big. So when you enter in, and I'll show you here, you can see it, yeah. When you enter in, your vein that you think is like this might be like this. So you go in like a dive bomber, and you go right through this vessel because it's actually like this. Happens all the time, and that looks really bad when you get an easy vein. So what you want to do is you want to come in like this as best you can at a nice angle and flatten it out. See, there's a giant difference there between the two angles. I'll show you down here. Oh, come in like that. So you want to go in, needles here, get a flash, and so just straighten that baby out. That's how you do it. Okay? Now, my thing with gauges, and everyone talks about this, and I'm going to tell you my ideas. I think when you're in clinical as an advanced EMT, I think that you should do as many hard IVs as you can, because when you get out in the field, you're not going to get. I'm not going to be your COPD patient. I'm not going to be your CHF patient. Okay. The only way you're going to see me, knock on wood, okay, is if I get in some sort of accident, down a trauma victim, okay, something like that, okay, okay, right? I'm not like a healthy guy, right? So you got to think about that. If I could do clinical over again, I never went to advanced EMT. I went from EMT right into paramedic school. But this is IV tips for everybody. Is I would have done more harder IVs during my clinical time, so that when I got on my own, I was more used to doing the harder one instead of going for the easy one. So that would be my tip to you. Do the hard ones, get better at them. That would be my tip to you. And the other thing that I do, and I still do, is any chance I get, I'll practice. Any chance I get, I'll practice on a mannequin. And you can always get better at IVs. You're never too good at them. Even me now. I went to medic school back in 2012. Graduated in 2013. Still, you can always get better and better and better. Always, at every skill. I can always get more crisp, always get a second faster. So those are some of my IV tips I give you. But I'm going to give you one of my bonus pearls. Now, this is a bonus pearl I'm going to give you, okay? Okay, and here it is. This is a from the field tip right here, okay? So what you can do with IVs, and I'm going to show you, okay? This is a behind the scenes paramedic coach tip here, okay? Now look, here we go. I'm going to go right here. Let me say right here, okay? So let's say you're trying to get somebody in the AC. You put one tourniquet, and by the way, send me a message if you do this and it works. Okay? If you do this and it works, send me a message. I'd be more than thrilled. Okay? Put a tourniquet right here. Okay? Okay, right here. Now let's say you look at my AC. You see nothing. Nothing. Arm, nothing. Don't forget to check back here also, by the way, guys. Okay? You check hand, nothing. Other arm, nothing. Go to the patient's arm. Let's say it's left arm. 2 minutes. You gotta pump your hand. 2 minutes. Pumping, cleaning before you clean, tap before you clean. Okay? Okay? You're going to AC where you're your landmark. Okay? And what you're going to do is you're going to take a second tourniquet and you're going to put it below the AC right here. So one tourniquet goes here, one tourniquet goes here, and then they're going to do the same thing. Lower and pump. Now you're literally double tourniquet that baby. And right in between, you're going to look and see if it pops up. Let me know if it helps you. Sounds crazy. Try it. It will help you. I've used that tip twice to get a successful lie on somebody where I had an issue. Okay? And there are times where I've used it as well. So that is my tip to you, my bonus tip on really tight IVs. One here, shoot him in the middle. Sounds crazy? Try it out. Okay? So now we're going to move into paramedic school. So let's say we got in, I'm going to scroll down my comments real quick. Scroll down. Okay. So let's say that we are going to paramedic school now. What do we do? Let's talk about it. So we're going to paramedic school. Now, this is going to blow your mind. I'm going to show you with it, okay? When I went to paramedic school, day one orientation, and boy, did I have a great, amazing, probably one of the best in the world instructors when I went to paramedic school. Shout out to Mr. Daniel Talbert. You're the man. You're the man. He was a great, great, great instructor. And my instructor, I'm not even sure if he's still teaching now. I hope he still is. If he's not, that's all good, but I'm pretty sure he still is. He probably still is. the first semester, the first day of class, we had 32 people. By the time he was done with his lecture, orientation, we were down to 30. Kid you not. Okay? So those people were gone. This was part of the reason that made me actually start the paramedic coach. Okay? Years later, as I thought back on what I'm going to tell you right now. And remember, paramedic coach means, everyone gets confused about that. It's EMT, Advanced EMT, Paramedic. We teach everybody. My programs teach everybody, from pre-EMT to Paramedic. Okay. At the end of that first semester, just from September basically, to like December, right? Beginning of December. Dude, we're down to 14 people. What happened? What happened? What the hell happened? I'm going to share with you what happened. Let's do it. Please, my friends, I'm trying to save you time, trying to save you money, I'm trying to save you effort. If you're going to paramedic school, you got to know something going in. You got to know what's going on. You have an awareness of a few things. Number one is cardiology. 2 is pharmacology. 3 is meds. Okay? So, now picture me, we know how TikTok is, we know how Instagram is, we know how YouTube is, we know how Facebook is. Picture me, 19 going on 20. I was about 20 years old when I went to paramedic school. I was 21 years old, and I was a licensed paramedic, cleared by the doctor, working my first paramedic job. And I remember sitting in the volunteer ambulance barracks saying, what are you doing? Evan, what are you doing in there? What are you doing? What I'm doing is I'm studying before I go to paramedic school. Why are you studying before you go to medic school? That doesn't make any sense. What are you studying that for? Why are you so obsessed? Okay. No problem. No worries. Well, I was one of the 14 that did well in medic school. So I want to help you with this. Paramedics, paramedic students, you need to study if you want to make paramedic school easier. Most people fail out of medic school in the first damn semester and waste their time and money. And who wants to waste? You want to gain, you want to learn. Okay? So cardiology, I'm going to give you a few tips. Okay? You want to know these things going in. Okay? The first thing is the basics of the EKG. Okay? What are the waves? What's the P wave? What's the QRS? What's the T wave? What does it look like? I just show you a little example here. Okay? Okay? P waves. P waves right there. Q, R, S, T. Right here is your PRI interval. Right here, ST segment. The ST segment has to do with heart attacks. There you go. There you go. Okay. What does it mean? We don't know yet, but we know that at least the labels, at least for there, I gave you a little quick tip. Now you know P wave, QRS, T. And the PRI interval is right here. And the ST segment has to do with heart attacks. Okay, great. Maybe you know more than you knew. Good. That's the whole point. Okay? So stuff like that. Okay? That's not it. I'll explain more. EKGs. What else should you know before you go in? Well, what you should know about is somewhat of an idea of what the main things look like. I remember my instructor asked the whole room of 30 people, okay, of all types of people. And I was one of the most least experienced. Man, I'm going to fumble night tonight. I got to get back on my marker game, guys. I was one of the most least experienced people in that class. So I'm in the front row, and I recorded every lecture, and I listened to the instructor while I was going through. And what I would do what I did before I went in, what I did before I went in was I tried to learn basic EKGs. I was trying to find every little piece of information I could back on YouTube in 2012, 8 years ago, okay? Who the hell knows what was on there, okay? That's what I was trying to do, okay? And I tried to put things together, and I got an awareness of this material, okay? So when he said, hey, what's this right here? And he says, and I wasn't 100% sure, but I was like 95% sure it was AFib. I was like, AFib? And he's like, you got it. And I'm like, holy shit, I know what I'm talking about. You know? Does anyone know about what's a common medicine that treats seizure patients? It goes by the generic name of fentanyl. Dilantin? You're correct. People are looking at me like, who the hell is this guy? Who's this young 19-year-old volunteer EMT? This is what I did. I pre-game studied before I went in, okay? So you got to know the basic EKGs. What's sinus? What's atria? What's ventricular? What's junctional? If you learn that before you go in, you have a better chance. Next thing is your pharmacology. We talk about alpha and the beta receptors, okay? We got to know these. So we got alpha 1, beta 2. Alpha 1 is going to vasoconstrict, okay? Pump you up, increase your blood pressure, okay? Beta 1, increase your heart rate. Beta 2 opens your lungs. What drug uses all these? Epi. That's why we give it for anaphylaxis, for its beta 2. We give epi for hypotension because of alpha 1. We give epi as a secondary resource in, do you know it? Low heart rates because of beta 1, right? We give it an anaphylaxis to open the lungs. We give it an asthma to open the lungs. See? Because if you know what a drug does, your drug card gets filled in automatically. So if you knew this, you already knew the rest of it. It all makes sense. So another thing people will ask me commonly, how do I get better at drug cards? You got to study the mechanism of action. But if you want to get really good at drug cards, how about you study the drugs before you go in? Why? Not just a study before you go in, because no one tells you that EMT and Paramedic School, Advanced Emt School, is one of the most accelerated schools that you're going to be taking in your life. You could take. It's super accelerated. Okay? And everything's foreign to you. Do you really want to go into the program with foreign information or from EMT or medic? Of course not. You want to have an awareness before you go in, and that's what we do here at the Paramedic Coach. Okay? Now, the other thing here is medications. What if you can understand prescription medications and EMS medications before you go in and make your drug cards that everyone complains about so much more easier? What if you knew that adenosine treated high heart rates? What if you knew that metoprolol was a selective beta 1 blocker that would treat patients with rapid AFib? What if you knew that? What if you knew that amlodipine was one of the most prescribed medications for high blood pressure in the US next to our friend lisinopril? What if you knew the brand names of those medications like Zestril for lisinopril and Norvasc for amlodipine? What if you knew that seizure medications you need to know you're going to get tested on, like Keppra and Dilantin, are most common for seizures? What if you can go to a call and know about all that stuff before you even went to school? This is why I do what I do, and that's the meds. Knowing your EMS meds and your med list meds. Because you don't want to go on a call. You don't want to go on a call and someone says, I got a new med, or here's my med list, and they're trusting to give you the med list and put it in your hands. They have a problem with their meds. They called you, and you have no idea about the meds. That's not okay, guys. No, that's not okay, man. It's not okay. And we don't get taught enough about prescription medications in EMS. That's why I do what I do, okay? Again, we talk about every level. There's no reason why you cannot learn more, Okay? There's no reason why you can't. And that's why I do what I do. You hear me? You feel me? All right. So now, my friends, I'm going to wrap up with a few things here, and let's talk about it. If you're somebody out there right now, and you are one of these 3 people, if you're preparing for school, if you're struggling in school, or if you're somebody out there watching right now, getting ready for their NREMT at EMT, Advanced EMT, or Paramedic level, and you want to not fall into these traps of not knowing this information before school, I have a program. I'm going to give you a chance right now to enter that program and get lifetime access to me directly to ask me questions throughout your EMS career and journey. Lifetime access to our community. Plus, lifetime access to my video vault of my best videos where I go in depth on all of this from EMT, Advanced EMT, and Paramedic. If you're an EMT right now and you want to become a great EMT, join the program. If you're an Advanced EMT getting ready for medic school, join the program. If you're a medic student who's on the brink of failing out of school, join the program. If you're a student right now who's struggling with the online environment and you want someone to teach you simply and concisely, I made this program. Worked night after night crafting this video vault for you. And finally, my friends, if you're someone who's struggling to pass the NREMT, get lifetime access to me and get lifetime access to my best video content, breaking it down step by step for NREMT at every single level. I'm going to put a link right here in the live, okay? And then I'm going to explain to you what we got going on for our giveaway and what we got going on for this week's YouTube videos and other cool stuff. You ready? Okay, here we go. So first off, I'm going to drop my link here so everyone who wants access can get access. I then want to go over a few things what I got going on this week, okay? Big updates. So let's talk about it. Okay, I just put the link in there for you guys. Now, inside that link, you'll see a video that explains a little more about the program. You get access to over 160 video and audio lessons, plus you also get access to a private community where you can ask me questions. Again, click the link there to check it out, but I want to make sure you're aware of it so you don't fall in this trap. Now, what do we got going on the rest of this week? Let's talk about it. So we got a lot going on, and I want to make sure everyone's up to date on what's going on, okay? So here's the schedule we got going on. You ready? Here we go. So tomorrow night is Tuesday. That's correct. Tomorrow night, I'm going live on TikTok. For the first time ever. I've never gone live on TikTok before. I'm going to be going live on TikTok tomorrow. If you got a TikTok, I'd love for you to join me, okay? We're going to be going live on TikTok tomorrow. It's my first one, and I'd love your support. If you're on TikTok, I love your support. Over on the live cast, if you made it here for Facebook and YouTube, it's going to be going live tomorrow night on TikTok at the same time for 9 p.m. Eastern, okay? So TikTok, live tomorrow at 9 p.m. That's where you're going to see me next, okay? 9 p.m. Eastern, okay? This topic is TBA. It'll be announced, but be live for TikTok, Facebook, YouTube fam. This is where my journey started. You know, you're my real core people here. So I'm testing out a live on TikTok tomorrow, exclusive live on TikTok tomorrow. We can go live on TikTok tonight. I'm going to test it out tomorrow. It's my first time. I'd love to have you there. We've reached, I think, over 11,000 followers. I think trending 12,000 followers on TikTok over the last month by putting out great content like this to help you, okay? I would really love your support. If you like me, like my content. If you don't like me, don't show up. But if you do like me, like my content, I love your support for my first ever TikTok live, okay? Tomorrow, 9 p.m. Eastern. Next place to see me live. Now, our giveaway is coming up, and we have some YouTube videos coming out this week I want to tell you about. Our giveaway is coming up on June 28th at 7:30 p.m. Eastern. Okay, so 7:30 p.m. Eastern, June 28th, I'm giving away this Master Cardiology. I'm going to show you what it looks like. Okay, let me show you what it looks like. Almost unveiled some secrets there. Hang on. Here we go. So here is the scope we're doing for the giveaway. You can see it. Okay. It's the brass edition, but it's gold and black. Okay. This is valued at about $250 a scope. Okay, the brass chest piece. So I'm giving this away plus $600 towards your EMS education. It's a one lucky winner. Okay. Anyone can sign up. Anyone can sign up for that. Okay. That is June 28th. Now to sign up for that, I'm going to put a link down below to sign up for the giveaway. So I'll put the link down there now. Then I want to tell you about the YouTube videos and what's going on. We got a lot of stuff going on, okay? So let me just real quick find the link from my Littman giveaway. Give me 2 seconds. Gotta find it. I'm going to put the link here for the giveaway if you haven't signed up yet, okay? Just give me a minute to get it. Okay, I got it. I'm coming back to the live. Here it is. So here is the giveaway. Now, here is the link to the program. So if somebody wants the link to the program, here's the link to the program, everyone. There it is. Is prepareforems.com. So the first link, the bit.ly/500 Littman giveaway, that is the link. That is the link for the giveaway. And the link for prepareforems.com is my program link. Okay. Jamila, you're correct. Yes, you did buy the package. I saw you come in. Big congratulations. Correct. That is everything that is covered on the National Registry exam. Correct. So what I've done is there's 5 main sections inside NREMT. Okay, you have stuff like airway, you have resus, you have trauma, right? You have EMS operations, you have medical OBGYN. I've taken that information and I put it simply and concise. Instead of looking at a giant book of all this information, I've made it like this, in video and audio form, straight to you. That's the way that it works, okay? Hey, Erica, what's up? Hey, April, what's up? Hey, Derek, what's up? Hey, Kiara, what's up? So now, next live appearance will be TikTok at 9 p.m. Eastern, tomorrow, okay? June 28th will be the giveaway, which is right here, 7:30. The link is down below for the giveaway and the program, okay? Now, I have some YouTube videos coming out this week. I'd love for you to be there. So YouTube videos. Now, I got a few cool videos coming out this week, okay? Now, I'm going to give you a little example, okay? 2 of these videos are going to be really geared towards EMT. And one of them, I did not announce yet, is going to be geared to everyone from EMT, Advanced EMT Paramedic, and I'm giving you one of my secret pearls that I have never shared from my experience out in the field in a YouTube video. So stay tuned for that one. It's stuff that I learned from interacting with a certain group of patients, and I'm going to share it with you. You can only get it from experience. I'm going to share it with you. From me to you, from my brain to you. It's coming out in the next week and a half. When you'll see it, you'll know. All right, my friends? So I want to tell you much love to all of you. I want to tell you a few things before I go. First thing I want to tell you is that I am extremely blessed that you all get value from what I do, because I absolutely love what I do. And I wake up every day, I go to bed every night. So I say my prayers at night. And then after that, I think about you. And I think about how I can serve the community better and how I can make a difference in EMS and how I can make every single EMS provider the most knowledgeable and the most strong they can be. That's why I do lives, not for 10 minutes, not for 20 minutes, for an hour and a half at 9 o'clock on a Monday night for you. Love you guys. Much love. And I'll see you next time. Take care.